Hey all, welcome back to the Real Life Pharmacology podcast. I've got an exciting episode on Fenofibrate today. Before I get into that, make sure you go get your top 200 study guide, 31-page PDF, absolutely free at reallifepharmacology.com. Simply an email will get you access to that. Great no-brainer if you're out in practice or if you're taking pharmacology classes. Definitely a lot of clinical pearls and a lot of things that show up in practice as well as on board exams. So again, you can get that at reallifepharmacology.com. All right, Fenofibrate, the drug of the day today. There's numerous brand names of this medication: Tricor, Fibricor, Trilopex, Triglide, lots of different brand names and even a few more. So with that said, what is this medication used for? The number one use, and probably the only use I can think of, or that I comes to the top of my head, is elevated triglycerides, so hypertriglyceridemia. Mechanistically, this medication is what's called a PPAR alpha agonist, which reduces apoprotein C, which ultimately inhibits lipoprotein lipase. Now, this all results in basically increased breakdown of cholesterol, such as VLDL, and elimination of triglyceride-rich particles. So that's definitely kind of a mouthful with the mechanism of action. On pharmacology exams, historically, if you remember that it's a PPAR alpha agonist, usually that does enough to get you by and be able to answer the question. So dosing-wise, there are multiple dosage forms, which I mentioned. So naturally, those dosages are going to range. There's dosage forms anywhere down to 30 milligrams up to 200 milligrams. Going to be dosed once a day. I don't think I've ever seen a Fenofibrate product dosed twice a day. Obviously, that's going to help adherence and things of that nature. There are a couple of terms I wanted to differentiate. So there are micronized formulations and non-micronized formulations. And basically a micronized formulation, to kind of briefly sum it up, is it helps improve absorption of the drug. So essentially you can get by with lower dosages because you or a lower dose gives you more bang for your buck if you've got a micronized formulation there. So again, increased absorption is primarily what you can think of when you hear of micronized formulation. Let's get into triglycerides a little bit. So differentiating categories. So patients with kind of mild to moderate hypertriglyceridemia tend to be in the 150 to 499 on lab values. Patients in the 500 to 1,000 levels of triglycerides, those are the patients that you're probably most likely to see on a Fenofibrate type product. With the advent of other agents, so if a patient has ASCVD, we're going to likely use another agent for lowering triglycerides. If a patient is low risk for ASCVD, that's probably the patient, again, in that range of 500 to 1,000 with triglycerides. That's probably the patient that we're going to target for use of Fenofibrate or another fibrate derivative. I went over gemfibrozole in a previous podcast as well. What's the deal with elevated triglycerides in the event that they don't, maybe contribute to ASCVD, or what risk in addition maybe to ASCVD do triglycerides present? And that is pancreatitis. That's definitely something that I've seen come up on board exams, pharmacology exams, physiology exams. High elevations in triglycerides, usually it's 800, 900, 1,000 plus. But the higher the triglycerides go, the greater it increases the risk for pancreatitis. If you also remember, patients with alcoholism is a big risk factor for that as well. So that kind of dual combination of elevated triglycerides and a history of significant alcohol use can increase that risk for pancreatitis significantly. So, long story short, that's why sometimes we use fenofibrate derivatives to manage hypertriglyceridemia and get that down to potentially reduce that risk. Brief mention on creatinine clearance. EGFR, creatinine clearance, less than 30 mils per minute. These medications should not be used. Also recommended to avoid insignificant hepatic impairment. Patients also with gallstones are probably going to want to avoid the use of this medication. Elevations in CPK, myopathy going on is probably not a good patient to start this medication either. With that, leading into adverse drug reactions, probably the most common thing I've seen reported is elevations in liver function tests, so that's definitely something to pay attention to with this medication. Obviously, that can be increased by the use of other medications or the use of alcohol. Other things that you may see, not crazy common, but GI upset, myopathy, and that's generally worse with gemfibrozole, but fenofibrate it has been associated with as well. Obviously, patients who are taking statins in combination with fenofibrate, that risk can go up as well. That gallstone history I mentioned, rarely hypersensitivity can happen. Elevations in creatinine have been reported as well. But I would say the elevations in liver function is probably significantly more likely than elevations in creatinine with the use of fenofibrate. Let's talk administration a little bit. Usually for most of the dosage forms, it doesn't matter whether you give it with or without food, or it's not particular to that. Phenoglide, Lipofen, those are two that are recommended to be given with meals. So might want to just double check the dosage form that's being used and making sure that we're administering it correctly. If you can't memorize those, which honestly I don't have them memorized either. I've got to look that up when I've got somebody on fenofibrate. Kinetics wise, fenofibrate is a weak CYP2C9 inhibitor, so I think that's an important thing to note. And I'll allude to that when I talk about drug interactions a little bit. And then last, before we take a quick break here, I want to talk about monitoring parameters. So in a patient that's reporting myopathy, and maybe they've got other risk factors like being on a statin, for example, you could potentially check a CPK to make sure that we're not progressing or increasing the risk of rhabdomyolysis. Those LFTs are going to be monitored, certainly, and then renal function may be monitored periodically as well. Now, most often with renal function, we've got patients that are taking an agent like this. They're usually on other medications. That renal function monitoring is recommended, so usually that's not an issue and generally not specifically done with fenofibrate, but usually it's done anyway because patients are on a bunch of other meds too. So with that said, let's take a quick break from our sponsor and we'll wrap up with drug interactions. If you're in the market for any pharmacist board certification study material like NAPLEX, ambulatory care, geriatrics, pharmacotherapy, BCM, TMS, go check out meded101.com/store. We've helped thousands of pharmacists pass their board exam, and we think we can help you too. So go check that out. Great way to support the sponsor. If you're a nurse, pharmacy technician, med student, NP, PA, definitely go check out meded101.com/store. We've got a bunch of different books and resources for anything from pharmacology flashcards, books on polypharmacy, drug interactions, food-drug interactions, lots of great resources that have been highly rated on Amazon. So go check that out. Support the sponsor, meded101.com/store. All right, drug interactions. First and foremost, when I think of fenofibrate, I do think about the risk for myopathy and rhabdomyolysis. So certainly adding on statins can increase that risk. And I do see that combination used in practice periodically. So definitely pay attention to that. it does increase the risk for myopathy and elevations in CPK and that progression to rhabdomyolysis. I will say fenofibrate is generally considered safer than using gemfibrozole with statins. There are other medications as well, other cholesterol medications, ezetimibe, for example. There's also medications like colchicine that are associated with increasing myopathy risk as well. So it's important to pay attention to those other agents too, not just statins in regards to drug interactions. And then I did mention in the kinetics section that fenofibrate is a weak CYP2C9 inhibitor. And there's probably two classic medications that I can think of that interact with CYP2C9. So Warfarin and phenytoin. So both of these drugs can have their concentrations increased with the use of fenofibrate. So I think it is definitely a relatively important interaction. Again, pretty weak effects on CYP2C9, but given the narrow therapeutic index window of warfarin and phenytoin, it's probably going to be a good idea to check levels if you initiate fenofibrate in a patient taking warfarin or phenytoin. And then last but not least, I wanted to mention increase in LFTs. So certainly that is a potential adverse effect, and patients who are at risk for elevations in LFTs already due to medications or drugs like alcohol, for example, this can increase that risk further. So I think of drugs with warnings on hepatotoxicity. So some of the DMARDs in like rheumatoid arthritis, like methotrexate, for example, that's a good example. Other medications with LFT warnings, amiodarone, for example, high-dose acetaminophen, in rare cases may contribute. So pay attention to those drugs with liver toxicity issues and their potential to maybe have an additive effect on top of fenofibrate. All right, well, I think that wraps up the podcast for today. Thank you so much for listening. Do me a huge favor, leave a rating review on iTunes or wherever you're listening. Share us, friends, colleagues, email listservs, any healthcare professional, student, healthcare professional in general. Help them learn a little bit more about pharmacology and share the Real Life Pharmacology podcast with them. I greatly appreciate that. We are well into the millions of downloads on this podcast, and I am definitely humbled by that. And I appreciate your feedback as well. If you've got any questions or concerns, you can reach out to me at mededucation101@gmail.com. Thank you so much for listening. I appreciate you taking the time to support the sponsor, meded101.com/store, and I hope you have a great rest of your day.